Hey everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to do one of my favorite topics, myth busting, but specifically regarding newborns. So you guys know that we've busted myths on this channel so many times in the past, but we've never really zoned in on newborns. And as I'm expecting my third right now, I thought it would be really helpful to go through some common myths that I have encountered or heard of as a pediatrician. Now, these old wives' tales can sometimes be harmless, but sometimes just lead to more anxiety for the parent. So I think it's helpful to know what the real science is and if this is possible. So I'm going to throw up this image of a baby. I want you to keep it in mind. We'll throw it up a few times, but as we're discussing certain things, it would be really helpful to have this imagery in your mind, especially when you're thinking about the baby's anatomy. So first up, let's talk about burping. The myth that a baby has to burp after every feed. Well, first of all, a burp is just essentially trapped air or gas in the stomach. That air can enter during a feed, whether your baby is breastfed or bottle fed, regardless of whatever position you might feed the baby in. That air can be present even if you've done all the right things and bought all the appropriate anti-colic bottles. But does it really bother the baby? Now, this really depends on your baby. Sometimes a trapped burp can be very uncomfortable for the baby. Sometimes your baby may not be bothered at all. So as you're trying to burp the baby, go through your typical burping positions that have been helpful for you. There's a couple that I recommend. And generally, if they're not helping after about 10 to 15 minutes, please give up, move on. It's okay. The burp might end up showing up in a few minutes on its own, or it may not even need to come up, and that's okay. Myth number 2, hiccups occur because a baby missed a burp. So this kind of ties in with the first myth, but I'm going to throw this image up here of baby's anatomy. So hiccups occur when the diaphragm, so this thin muscle that lies right underneath the lungs and where the stomach is actually right below, hiccups occur when the diaphragm gets activated and starts moving up and down. Oftentimes your child might have hiccups because they actually have a full tummy. And that full tummy causes expansion. So the diaphragm gets a little activated and then starts to just move up and down. And honestly, they're not problematic. They're not serious. They're not a cause of concern. You don't have to feed your baby gripe water. It is okay if your baby has hiccups. It is totally normal. And in fact, I tell parents it's a good thing because it means that they obviously drank enough milk or formula that their stomach expanded. So rest assured that hiccups are not a problem. It has nothing to do with necessarily a missed burp. Now, obviously, if there's some trapped gas, just like we talked about, when it comes to a burp, then sure, I guess it could cause hiccups. But even if the hiccups occur, it's not necessarily something you need to worry about. What about spitting up, right? So the myth that if a baby spits up formula, that means that they don't like it. Not true. Babies can spit up for so many reasons. It can be completely normal. Again, throwing up the image right here of the baby and the baby's anatomy. There is a tube that goes from the back of the throat down to the top of the stomach, and that is called the esophagus. The esophagus, as I describe it to parents, actually has like 2 hair ties or 2 rubber bands, if you will, on either end. And these are called sphincters. They're made of muscle, and it takes some time for that muscle to develop. So they're loose hair ties. And so in the beginning, if they're spitting up commonly, just imagine that it has to do with those sphincters not really having enough time to develop. And they will get better. Your baby won't spit up forever. Instead, as a pediatrician, what I really, really want you to focus in on is how the baby is looking or feeling or acting when the spit up happens. If they're not in distress and they're not bothered by it, I'm kind of not bothered by it, especially if the weight gain is going really, really well. So please, if your baby spits up, it does not mean that they don't like their formula. And we have so many newborn myths that we're actually going to be doing this in 2 parts. So the last myth that we're going to be discussing in today's video is sneezing. Sneezing in a newborn means that they are cold or that they're getting a virus. Not necessarily. So, especially in the initial hours to days right after a newborn is born, you might find that they are sneezing very frequently. The best way I kind of describe this to parents, especially in the nursery right after baby is born, is there are a lot of new things in the air for the baby to smell, and there are receptors in our nose, and anything can kind of activate them. So, anything can really get trapped in their nostrils and the little hairs in their nostrils. It could even be some retained amniotic fluid, and sneezing is their body's way of expelling that or getting rid of whatever irritant that might be that's bothering them. So I would not consider that sneezing isolated alone with no other symptoms, no fevers, nothing like that, and acting normally is a sign of an illness. But if you have questions, please make sure you ask your pediatrician. And generally, if you have any questions about these myths, definitely make sure you talk to your child's pediatrician. Obviously, this video is just for educational purposes, does not constitute as personal medical advice. I hope this was helpful. Make sure you stay tuned for Myths Part 2, where we discuss more things related to newborns that are just not true. Hope you guys have a good week. Bye.